Assalamualaikum warahmatullahi wabarakatuh and a very good evening to all. Knee osteoarthritis is very common, especially among older adults. Today, I will present my cross-sectional study entitled Correlation between Knee Osteoarthritis Symptoms with Resilience Level. My name is Siti Norman. I am from Universiti Kebangsaan, Malaysia. This is my presentation outline for today. I will cover from introduction until conclusions. To begin, let's see the prevalence of osteoarthritis around the world. According to National Health and Nutrition Examination Survey and Framingham Osteoarthritis reported that there are about 65% increase of knee pain from 1983 to 2005 in US. In Germany, about 30.9% citizens aged 40 years old and above reported for knee pain. Similarly, in Sweden, about 25.1% within a representative sample of 10,000 individuals aged 56 to 84 years old reported for knee pain. Meanwhile, in China, the prevalence of knee pain was reported about 44% in men and 56% in women aged 50 years old and above. Lastly, in Malaysia, about 33.3% of older people was reported presents with knee pain and 27% presents with symptoms of knee osteoarthritis. In terms of gender, females are more likely to get knee osteoarthritis compared to men. Next, we move on to resilience. In brief, resilience is a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationships problems, serious health problems, or workplace and financial stresses. In terms of pain, resilience is demonstrated as the competency to abide and handle pain such as comorbid chronic disease and psychological stress from social and cultural expectations. For methods, this study used cross-sectional study design with purposive sampling in Kuala Lumpur and Selangor area. The study involved Malaysians aged 60 years old and above and able to give informed consent. For diagnosis of osteoarthritis, two diagnostic methods were used to identify the presence of knee osteoarthritis, which are self-reporting and clinical examinations. All participants were assessed for the presence of knee osteoarthritis during the visit for confirmation. Any absence of pain was not included as osteoarthritis sample. For resilience, my study used the Corner-Davidson resilience scales to measure resilience, or how well one is equipped to bounce back after stressful events, tragedy, or trauma. This study used CD-RIS-10, which is a shorter form of CD-RIS. It used 5-point Likert scale ranging from 0 to 4. By summing the score of all 10 items, the minimum score will be 0 and the maximum score will be 40. The highest score indicates higher resilience level. For statistics, this study used correlation analysis to measure the strength of the linear relationships between resilience and knee osteoarthritis symptoms and compute their associations. For results, a total of 291 older adults mean age of 66 years old were recruited from December 2021 until July 2022. 131 participants were diagnosed with knee osteoarthritis and 129 participants have no knee osteoarthritis. Out of 131 participants, only 96 participants were included in the study based on their completion of osteoarthritis and resilience survey. Among them, about 35.1% are men and 64.9% are women. So, this is the main finding of my study. Graph 1 shows the scatter plot of resilience and knee osteoarthritis outcome measure score, COOS. I found that there is a significant positive correlation between increase in ADL score with Spearman row of 0.282 and also sport activities with Spearman row of 0.227 with level of resilience. Please note that the increase in COOS indicates better knee condition. This study suggests that there is a significant correlation between resiliency with ADL and sport activities, suggesting that older individuals suffering from knee osteoarthritis might have better physical functions once they become resilient. A previous study has shown that people with higher resilience level are able to adapt to changes, accept the consequences, and have better outcomes in their quality of life. This study proves that the different resilience level affect their quality of life. The benefits of having resilience help to build good coping skills and improve cognitive thinking skills. Besides, people will know how to bounce back from the adversity in a healthy manner. Clinically, resilience contributes to the prevention of the onset of disease, provides better health, facilitates the healing process, and provides a more productive life and well-being despite chronic illness. In short, people with resilience are advanced in health, and when people suffer an illness, resilience is it and facilitates the healings. This study has a few limitations. Firstly, it is limited to older adults living in KL and Selangor area. I recommend the future studies to broaden the population to other states in Malaysia. Secondly, there was a lack of radiographic quantification of the knee osteoarthritis to properly diagnose the OA level. And lastly, cross-sectional study design limited this study to draw a causal inference. So, our study highlights the importance of resilience in managing knee osteoarthritis, specifically in older adults. An increase in resilience is positively correlated with an increase in ADL and vice versa. It could be that the individuals who suffered knee osteoarthritis can have better ADL if their resilience improves. In conclusion, I recommend the future study to do a longitudinal study uh, to explore on the impact of resilience toward quality of life and also arthritis related symptoms. That's all from me. Thank you.